hysterectomy as part of the endometriosis treatment, not instead of endometriosis treatment.
I've come across one too many women who have been given hysterectomies or oophorectomies with and without any sort of diagnosis, like not even endometriosis, not adenomyosis. It's just they've got these pelvic symptoms and it's decided that the reproductive organs are to blame because they're cyclical, so let's take them out. And of course, in cases of endometriosis, there's disease progression, the symptoms persist. So what are your thoughts on hysterectomy as a treatment for endometriosis? And should it be secondary to excision surgery?
Well, a very good question. And as always, the devil is in details, right? It's very difficult to exactly localize the main predominant source of pain in endometriosis patients. And we know that endometriosis and adenomyosis are seen together very, very often, like 80-90% of cases. Let's say have like hypothetical situation where we have a patient who is suffering a lot from endometriosis symptoms, and she's finished with her fertility. She had enough children and she's not interested in more pregnancies. And she has severe pelvic disease like bowel disease or bladder disease or both, peritoneal disease, and adenomyosis. So the best surgical treatment for this type of patient will be excision of endometriosis plus hysterectomy. That will provide a more sustained and more long-lasting relief of pain. However, if you do only hysterectomy but leave the bowel and peritoneal disease behind, that's not going to do anything to her pain. It may stop her bleeding, but the pain will still be caused by residual endometriosis. The same as removing all endometriosis, but leaving a huge adenomyotic uterus behind, that may relieve some pain, but if the uterus is predominant cause of pain, then this pain is not going to change. And I know it's easy for me to say remove everything just because I'm a surgeon, but with endometriosis, we have individual approach to this because some people would still want to get pregnant. That's why you cannot remove the uterus. Some people would say, no, I definitely finished with pregnancies. I have enough children, or I stopped trying, but I want to get rid of the pain. In this case, hysterectomy as part of the endometriosis treatment, not instead of endometriosis treatment. And that's a viable solution.